Would you please welcome to the Public Health Innovations Conference 2016 on Experience Matters, please, Alan Lilly, CEO of Eastern Health.
Thank you, Tracy. Good morning, ladies and gentlemen. It is indeed a great pleasure to be here. And I do just want to say, though, thank you for the opportunity to be able to come and talk to you today about patient experience, and in particular, the work that we have been doing at Eastern Health. But I also wanted to take the time to say happy birthday also to DHSV, and it's great to see this organisation going from strength to strength, recognising its traditions and its history, and what a fantastic celebration to have had so many people there last night and also so many people here today. It's great also, I should add, to see so many people becoming much more interested in patient experience, and probably 5 years ago we might have had a room with perhaps 50 people, and nowadays it's not uncommon to have rooms with 400 to 500 people who actually want to talk about patient experience. So it's a great platform to actually encourage people to get onto, because it is indeed a great platform for actually making changes in organisations as well. I would also just like to acknowledge the traditional owners of the land on which we are meeting today, and also to pay my respects to their elders, past and present, and indeed to any other elders and community members that are here today. So what I would like to do in today's presentation is really talk to you about obviously what we've been doing at Eastern Health, but also give you a little bit of context with respect to what Eastern Health is actually all about. I want to talk to you about creating a focus on a great patient experience, which is what we're trying to do within Eastern Health. To talk to you, importantly, about what our patients are actually saying, and also to contribute to the thinking and the future in this field. So I would also encourage you to actually join the conversation on Twitter, because what I find interesting is when I welcomed 115 new graduate nurses earlier this year and 70 interns, less than 5% of them would actually be on Twitter, yet 100% of them are actually on Facebook. So that was really just interesting, and I think what it reminds me is that Twitter is a great platform, I think, for sharing information at a professional level. And I should also add that I've picked up lots of really, really good resources actually using Twitter, so I would encourage you to actually join that conversation. So just in terms of Eastern Health, we are many, but indeed we are one. And our mantra is Eastern Health in name, in thinking, and in service delivery. I've been in post now for just over 7 years, and the focus of the organisation has really been to move away from being very site and individually site-focused, and more so to actually operate as an integrated health service. So we have still, in our organisation structure, we recognise the importance of the site, we recognise the importance of the site to the community, and we also recognise the importance of the site to people who actually might want to come and join our organisation. So within our organisation structure, we actually have chiefs at each of our individual sites right across Eastern Health, but they all report through to one executive director, and I think that really makes us much more integrated, and we have a huge focus on our clinical programs right across Eastern Health. But you can see there that we are large, and we are certainly, in terms of our primary catchment area, which is the orange area there on the map, it actually makes us the largest health service in Victoria, because we're covering 2,816 square kilometres. And I'm sorry if anyone has heard me say this before, but it's a little bit strange, because I came from Alfred Health, and we used to say that we were the largest health service in Victoria. And prior to that, I worked at Monash Health, and we used to say that we were the largest health service in Victoria. So I thought I should just clarify for you that $1.4 billion, Monash Health is definitely the largest in Victoria. 2,816 square kilometres, Eastern Health is definitely the largest in Victoria, and EGO's Alfred Health is definitely the largest in Victoria. I should add, it's a great place. It is absolutely a fantastic place to work, but you know, there's not much space in the corridors sometimes. So you can see there, as I mentioned before, we've got 9,500 staff and volunteers, so a large organisation in terms of actually engaging our people. And I'm really proud of the fact that we have such a huge commitment to our volunteers and also to and many auxiliaries right across Eastern Health, because they are, in many, many ways, they are the lifeblood of the organisation, and they provide a great connection also back to our community. But as I always say, I'm not sure how much your budget is within oral health, but we spend $850 million per year, or $1,500 per minute, or $2.1 million per day. So when people say to me there's not a lot of money in health, I'm always very quick to say there is actually a lot of money. It's really a question at the end of the day about how we prioritise that spending. And I'd have to say I was alarmed in terms of hearing Deb's opening address this morning to actually hear about 15-month-old babies actually having teeth extracted. And clearly, I'd have to say, if the line was designed to actually grab attention, you certainly did actually achieve that. So thank you, Deb. So I just want to talk to you about what's important to us in Eastern Health. And it's really interesting now, of course, on the back of Julie's presentation, for my first point, to actually be talking about the culture of the organisation. This is the same slide that I've now been using for the last 7 years within Eastern Health. And I use this at all welcome events for new staff, within all of our management development programs as well. And the messages have actually been consistent over that period of time. But for me, in terms of the culture of the organisation, ultimately, it is about seeing and feeling the values in action. And so I do actually spend a lot of time talking about values, and in particular, of course, talking about behaviours, but importantly, understanding, as Julie has outlined also in her presentation, the correlation that that actually has with the care which is actually delivered to our patients, to our residents, to our clients, and also, of course, to their families. And so for me, I talk about if we live the values and we see those in action, when people actually feel that and they see it around the organisation, people will actually describe that as our culture. And then when they talk about their experience of our culture, that is actually our reputation at work, both within Eastern Health, outside of Eastern Health, at both the professional and also at the community level. And I have a story I just want to share with you very briefly, because I think sometimes the whole notion of culture can actually be a little bit esoteric. And so I tell a true story of one day. I've got 3 daughters, so I've done my fair share of netball duty on a Saturday. And one day I was on netball duty, and Stephanie's mum was there. And I hadn't really had a chat with her, sort of before. And you know how you do that sort of small talk, sort of when you're at some of those sporting events. And so I'm chatting to Stephanie's mum, and I said to her, "Oh, hi, Stephanie, I'm Alan, and we're just having a bit of a general chat, and then I asked her what she does, and she says, "Oh, I'm a nurse." And I said, "Oh, terrific, where do you work?" And she said, "Oh, I work at Cabrini." And I said, "Oh, that would be a really nice place to work, because, I think it actually would be a great place to work. It's a Catholic healthcare organisation, has a very good reputation. Michael Walsh is the CEO, highly regarded in the sector." And she said, "Oh, yeah, it's absolutely fantastic." And she raved about how good it was working there. Then she said, "And, you have free car parking," and that really did grab my attention. But as some of you would know, that story was a long time ago, because you'll recall they actually changed that last year, and there was a lot of media about that. But she was really raving about how fantastic Cabrini was. And then she said to me, "Oh, Alan, what do you do? Where do you work?" And I said, "Oh, I actually work for Eastern Health." And she said, "Oh, what's Eastern Health?" I said, "Oh, the Angelus Hospital, Hillsville, the Peter James Centre, Wantirna, Box Hill Hospital." She said, "Oh," she said, "that Box Hill Hospital." And I thought, it's sort of, I'm really torn, because it's Saturday morning, we're supposed to be watching the netball, but I'm actually really, I really am sort of interested to see what she's got to say, but it's just got that negative sort of feel about it, And she said, "Oh, Alan," she said, "my friend's father-in-law was in there recently." She said, "Oh, the care was just terrible." And it was just, I had one of those moments when I thought, gee, I wish the earth would sort of open up and take me, sort of right now I feel ready to go, And it was just like everything had gone wrong with the stay, and they the family themselves hadn't actually felt sort of that they'd been treated very, very well. And I was really sort of quite horrified, and it was really like the Swiss cheese, everything was sort of lining up. And then this other woman turned around and said, "Oh, are you talking about Box Hill?" And I said, "Oh, yes, we are." I just thought, oh my God, this is the last thing I need. And she said, "Can I just tell you," she said, "I know it's a really old building," so you can tell it's an old story, because, of course, now we have a very new building. She said, "I know it's a very old building," she said, "but let me tell you, my father-in-law was in there recently, and the care was absolutely outstanding. The staff were absolutely fantastic. We felt so well cared for." And I just thought, oh, you beauty, thank you so much for turning around. And she'd only just come into the conversation. She said, "Public health care is really fantastic, compared with those private hospitals like Cabrini." And so I've been telling that story, and I do sort of, I'm sorry for anyone who's heard me say it on numerous occasions previously, but it just illustrates the point so well, that it's all about making every interaction a positive interaction, because that is in fact what people will be talking about. That's what they'll be talking about in their own local communities, and that's what they'll be talking about in netball on a Saturday morning. So I'm very focused on making every interaction a positive interaction. The other point I just want to mention before I actually share with you our patient experience of care program is that we really aim to be great at what we do. And when we talk about being great at what we do, my personal sort of inspiration has actually come from the work of Jim Collins, who wrote a great book called Good to Great. And I'd have to say, if you ever want an inspiring book about leadership to read, it's all evidence-based. It's absolutely inspiring. And so really, you know, for us, being great means we don't want to be mediocre, we don't want to be average, and we certainly don't want to be middle of the pack. And so we truly want to surpass patient, family, resident, client expectations, but also importantly, the expectations of our staff, because what I really want to hear is that Eastern Health is a great place to learn and work, and there is such a huge correlation, as Julie has so eloquently described in her presentation this morning. And finally, that if in fact we are creating these relationships and we are creating these experiences, that's what people will be talking about in the community. That's our reputation at work, and that's the confidence or otherwise that our community will actually have in our health services. So at the end of the day, it is all in fact quite related and very, very important that we make every interaction a positive interaction. I just want to share with you at the outset that we decided to make a great patient experience one of our 5 strategic directions within Eastern Health. When we developed our Eastern Health strategic plan back in 2010, there was a lot of discussion, you know, should we have 5, should we have 6, should we have 4? And there was a lot of discussion about, well, you know, a great patient experience, it's really about being a provider of great health care. You know, why don't we just put it in and we'll just have 4? I was absolutely adamant, as indeed I should add so were many others, that if we truly want to make a great patient experience and we want to focus on a great patient experience, it has to be there on its own. It actually warrants its own sort of day in the sun and its own organisational focus. So that's really, I guess, been one of the key drivers of moving along on our journey of improvement. And so under a great patient experience, we've got 4 further strategic goals, but really at the end of the day, it's all about influencing how we can ensure that our patients have a great patient experience. So I just want to share with you a definition. So there are lots of definitions. We had a workshop, in fact, with PwC, who were consulting and doing some work for the department a couple of years ago. And we all actually, on that day, had to write our own definitions. And this is the definition that I wrote. The reality is that all of the definitions are very, very similar. And what it really outlines is, excuse me, it's not a singular event, it's the sum of many, many parts. And what I want to encourage you to do, but in the interest of time, I thought we probably wouldn't stop and actually watch this DVD. But if you haven't already watched the DVD, the YouTube clip from the Cleveland Clinic called Empathy, can I please encourage you to actually watch it? It takes 4 minutes and 23 seconds. It's absolutely inspirational to watch it, and it's the perfect reminder that in organisations there are so many things happening, not only for patients, but as Julie rightly pointed out in her presentation, but also for the staff. And I think that DVD picks it up beautifully. So I'd encourage you to actually have a look at that. Now, in terms of our patient experience journey and your patient experience journey, has anyone yet passed this sign? It's just a few hands at the back. No, only joking. No hands at the back. No, and I think it's interesting, isn't it, that I think when it comes to patient experience, that it's quite new. People are nervous about taking feedback directly from patients and responding to feedback. There's somewhat sort of, it's somewhat confronting, and you know, Julie gave the example of the people working, I think, in the outpatients department or in the complaints department in some cases there, who make excuses essentially for people's behaviour. And I argue, when I'm talking about patient experience, that unless we think we have actually arrived in perfection, then all feedback is welcome, because that's truly about making us an organisation that's actually ripe for improvement. I think really importantly, though, is that we must also learn from other organisations. So we can look around and say, we know what is going to be good and what we can actually do to maybe improve the patient experience and monitor the patient experience. but we also need to learn from others. And I don't know how many people here, I might just ask for a show of hands, how many people here have heard of MidStaffs? So it's not a large number of people put up their hands, and you may be surprised to know that in less than 10 years ago, MidStaffs had up to 1,200 unexpected deaths. And I've taken a huge interest in this because, in fact, I am actually from Staffordshire, and this is our family local hospital, and I've had the pleasure in the last 5 years, actually, on one occasion of actually going to talk to the CEO who came in after all of this to understand what can the rest of the world learn as a result of what actually happened at MidStaffs. And last year I gave a presentation to our board called Could MidStaffs Happen at Eastern Health? So part of that work is also something that I'll be sharing with you later. But what happened at MidStaffs? What happened at Bristol Royal Infirmary in the early 1990s, where children were undergoing unnecessary surgery? What happened at the King Edward Memorial Hospital in Perth? And sadly, most recently, what has actually happened recently in Victoria with the Djerriwarrh Health Service and unexpected, again, perinatal deaths. So what we learned from all of these, and Don Berwick, international quality guru, former president of the Institute for Healthcare Improvement, when he was asked by the NHS to do a review of the NHS to answer the question, could MidStaffs happen around the rest of the NHS? The answer was yes, it could. And what he actually said was, we need to learn, and no one is learning. Sir Robert Francis conducted 3 inquiries into MidStaffs, 2 of which were actually public inquiries. He said that the word hindsight was used 123 times in millions and millions of pages of reporting. So we really need to turn the hindsight into foresight, and we really do need to learn from what has happened. Don Berwick concluded, when he was asked then to do his review of the NHS, he concluded that if we had taken the recommendations and the learnings from the Bristol Royal Infirmary, then MidStaffs should never have happened. And this is really, really sad. And what do they all have in common? They all have in common failures of leadership and culture in organisations that actually allowed poor and unsafe standards to actually continue. So the salient point here is what Don Berwick says, and I've just sort of encouraged you to have a look at that in that first point, is to engage, empower, and hear patients and carers at all times. We need to move away from our comfort of working in our respective professional disciplines and domains, and we really need to put the patients back at the heart of our thinking. And I think for most of us, that actually makes sense. It's sort of intellectually, it all comes together. But sometimes, as we know, the words are easy and the actions are indeed much harder. But the other point that I would make is that not to do that is absolutely at our peril. So, in Eastern Health, we've introduced a program called In the Patient's Shoes. And I must admit, I was thinking this morning, this is the first sort of presentation I've ever done in such a specialist forum. And I suppose In the Patient's Shoes probably wouldn't work so well maybe in dental. But I know I had lots of things going through my mind as to what you might replace the shoes with, some of which I perhaps shouldn't share with you, because you may not think it was as funny as I thought it was when I was thinking about it. Nonetheless, In the Patient's Shoes, it is about sort of getting in and understanding the journey of individual patients. And our program is about setting the standards and the expectations, measuring and monitoring performance, reporting on this, and also engaging our staff and our patients and our communities into the things that we need to do to improve that patient experience and actually create some action. So Julie, sadly, notwithstanding your slide earlier, we have actually established very proudly a Centre for Patient Experience. And the Centre for Patient Experience is both a virtual and also a physical warehouse for maintaining, recording, receiving all of our information right across Eastern Health. So, as you remember, Tony Abbott said this would be a suppository, when in fact I think he meant it was a repository for all information with respect to patient experience. We also have our patient relations advisors, and I'd have to say our first line of defence is in fact and we'll show you that, we're trying to encourage the feedback to actually be dealt with and managed at a local level. What this does is actually provides us with an organisation-wide response and also enables us to actually follow up and ensure that patients' concerns have properly been addressed. We also decided that we needed to decide what a great patient experience would actually look like. So if our work was successful in terms of trying to transform the way that we were thinking as an organisation, what might a great patient experience look like? So we took the work that was already done at the Picker Institute, and we worked in conjunction with we have an expert advisory committee on patient experience, and we also have a community advisory committee. Some members of the community advisory committee are also members, of course, of our expert advisory committee as well. And these are the 10 areas, and I'm sure you can look at them just as I do. You can relate to all of them, and you would think if we were excelling in all of those, it would indeed be a great patient experience. You know, yesterday I came back from Sydney, and I said to my wife last night, and I don't know whether you've noticed this, but there is something discerningly different happening with Qantas. And I don't know whether you've had this experience, but I reckon they had a little bit of a fright, you know, sort of a couple of years ago with respect to, you know, Virgin having a much greater market share. And I'd have to say that I am becoming impressed once again with Qantas. But of course, it's about every interaction being a positive interaction, so I only need to have a few that are not so positive, then I might go back to Virgin. I'm not sure just yet. And of course, it's always a dilemma with those points, isn't it? Of course, you want to keep them active as well. But it's really interesting because we do know, and patients certainly know, what a great patient experience actually looks like. And it seems sort of easy, but we know, again, the words are easy. The actions are indeed much more of a challenge. In Eastern Health, it all starts with our name badges, and I spend a lot of time talking about name badges. I also, as I go around all of our departments, if someone is not wearing that name badge, I will ask them why they're not wearing their name badge. I will also offer to get them a new name badge, and I will often, because we make it close to where I'm actually based, if it's in Box Hill, I'll get the badge and I'll take it back to the area myself. And if not, if I'm out, say, at Hillsville, I can look up the person's name, of course, on our information system, and I will send the badge then to their home address. So the people know in our organisation that it is really important. And it's not just important because it's really good, it makes a very large organisation quite personable. It's actually really good for patients, and our badges have been specifically designed to meet the requirements for people with a visual impairment. So it's black lettering on a white background, upper and lower case, just, you know, at the beginning of the first name and the surname. All managers have to have first name and surname. The rest of the organisation can just have their first name. It's not meant to be a person's CV. It's actually meant to identify to the patient that my name is Bob and I'm from physiotherapy, or indeed I'm a physiotherapist. And that's really the purpose of the badge. Increasingly in organisations, I see badges actually being used, and people like to have their logos and they put their FluVac stickers on them as well. But it actually takes away from the essence of what we're actually trying to achieve. But for me, this is so important. We have a policy requirement in Eastern Health that people have to wear their name badge. And I can just tell you from a cultural perspective, and reflecting on some of Julie's conversations, this was so hard. When I started there sort of 7 years ago, I came from Caulfield Hospital, where we started using these badges as part of our Better Care for Older People program. And I couldn't believe how hard it was. I felt like I was trying to teach people why it's important to drink water. You know, why wouldn't we actually be wearing name badges, and why would we have a problem? And in groups, I would often say, what exactly are you doing to patients that makes you concerned that they might actually know your name? Because in many, many cases, you would think that even if they weren't wearing a badge, surely they'd be saying, hi, I'm Bob, I'm the physiotherapist, and I'm here to look after you today. So this has been quite a journey, but I'd have to say now, very well accepted right across the organisation, and we have very, very high rates of compliance, which is part of our regular ward auditing program, and get great feedback from patients. And interestingly, the patients write to the newspaper. So one of the patients wrote to the local leader newspaper. And it's funny, isn't it, that patients write to the local leader newspaper to say, you know, it was in Box Hill Hospital recently and the staff were wearing their badges, isn't that great? But they didn't actually write to us and tell us that they thought that was a good idea, because there's something, isn't there, about actually writing to the newspaper. So now I just want to share with you what our In the Patient's Shoes program is actually all about. And there on the left-hand side, you can see our commitment to actually engaging consumers directly in what we're doing. So we have mystery shoppers, we have consumer forums, we have rapid improvement events, and in all of our rapid improvement events across Eastern Health, and now we have many, a rapid improvement event methodology is essentially a lean methodology, and instead of doing a project, you know, over 8 or 12 weeks, you basically take people offline for half a day and you do the work in a very intensive, facilitated fashion. It's been fantastic for getting engagement because, of course, as long as you can be there at that event, you'll be fully immersed in all of the, I guess, the discovery, but also importantly, all of the processes with respect to the changes moving forward. And shadowing is also heavily used across our organisation. So the mystery shopping isn't in any way, shape or form punitive. It's not like, you know, when you go in to buy petrol at Shell and they ask you, did you want some chocolate? And, you know, sometimes it is actually very tempting. Oh, maybe I did need that chocolate, but I didn't think I did need it, you know. But they ask you, and of course, often they'll be asking you because they know that we could actually be their own Shell silent shoppers. And my mother-in-law worked in the ANZ Bank, and she said she reckoned she could ultimately spot who the silent shoppers were just based on their questions. And my daughter, my middle daughter, works at Grilled, and she says that she thinks sometimes based on the questions that people can ask. And apparently the other week they had a staff meeting because apparently people weren't asking all the right questions when people were paying at the till. So they knew that, you know, the silent shoppers had actually been in. So it's a very good concept, but we don't use it for any punitive purposes. It's absolutely, I sat in the emergency department for 2 hours and this is what I observed. So it's actually a very good and it's a very informing process. Then we've got along the bottom there, we use patient experience trackers. So just, I'll show you coming up actually in a moment, a picture of a patient experience tracker. You may have seen them in Bunnings or in Masters or indeed at the airport. People are asking you there to rate your experience. So we use the patient experience trackers. The data is transmitted to a warehouse in Sydney and the data actually comes back as quickly as the following day. If you use them in a real-time sense, you can therefore tell the difference between what happened on yesterday morning shift and what happened on yesterday afternoon shift. So it's actually that sensitive. It's a fantastic tool. We've been using that tool now for just about 5 years, but we're now using those mainly project-based. So we ask a set of questions before we create an improvement, we do the improvement, and then we ask a set of questions afterwards. We've now moved along to the next one, which is the Eastern Health Patient Experience Survey, which we do via Audit Angels, which is essentially via iPad technology, and we ask 10 questions based on those 10 principles of care, which I outlined earlier. Then we have the Victorian Health Experience Survey, which is externally administered. We don't have such a huge response rate compared with our internal survey, but it actually gives us very rich and also very meaningful data. And then you can see that we have a whole section there related to patient stories. So we are prolific users of the public online platform called Patient Opinion. It's free for patients to use, and I'll show you how we're actually using that. And I can say to you, this has been one of the best things as an organisation that we have done, and it has also been one of the least expensive things that we have done, and it certainly has given patients an absolute voice in our organisation. Leadership walk-rounds, all of our managers, our senior managers have to do 3 leadership walk-rounds and talk to patients every quarter, and that data is then, it's qualitative data, it actually gets fed into our system, and the monitoring of whether or not people are doing the leadership walk-rounds is actually monitored by our Community Advisory Committee, our Expert Advisory Committee, and of course ultimately by the board. And it was really powerful one month to have had the discussion with our Community Advisory Committee who said, Alan, is there a problem with the leadership walk-rounds because we'd had a particularly bad quarter. So it's really, really good to have that level of engagement and interest. And there at the top on the right-hand side, a number of ways that you can contact us. By email, call 1800 Eastern, you can speak to one of our patient relations advisors, you can pick up one of our cards around the organisation, you can put it into one of our feedback boxes. So we have multiple means of taking both quantitative and also qualitative information. And can I just say to you that a few years ago, when we went to Bali with Jetstar, which wasn't one of those great one of those great passenger experiences, I wanted to give feedback to Jetstar simply because 4 people were assigned, the same as our family, were assigned to the the room where we'd paid, the row where we'd paid for extra leg room, but the other family got on before us. Well, we couldn't say we were any more entitled than they were. We'd all paid for this extra leg room. I wanted to give that feedback to Jetstar. I went on, I put Jetstar feedback, and I got so many Google hits back on how hard it is to give feedback to Jetstar, which I find really interesting for a private organisation compared with us as a public sector organisation, how we're truly trying to engage with patients and receive their feedback. I just want to share with you quickly how times have changed and how, in terms of actually providing feedback, many more people used to write and provide their feedback by letter. Increasingly, though, now people are actually calling us on 1800 Eastern, or in fact they're using email or indeed patient opinion. So I'd just like to share with you then what our patients have been saying, bearing in mind now we've got more than 23,000 pieces of coded information. So complaints, leadership walk-arounds, compliments, any of the feedback which isn't quantitative, we actually code to those 10 principles. And we can also see there that we've got more than 18,000 quantitative surveys. This has really been a journey, and our processes are currently under review, and a couple of our current strategies we're planning to drop off, and we're planning to replace them with a couple of new ones, keeping pace also with technology. On the left-hand side there, you see feedback for improvement, and on the right-hand side, you see positive feedback. So all of these comments have been correlated against each of those 10 principles. Interestingly, what you can see there in the purple and the salmon and maybe the lavender colour is that we get a lot of feedback that we need to improve in Principle 1, Principle 3 and Principle 7. But when you look at where we're also excelling, we also get lots of really positive feedback about Principle 1, Principle 3 and Principle 7. And what that's really telling us is that those principles are really important to patients, because either some patients think that we're doing it really, really well, or their families think that we're doing it well, and others don't actually see that. So what's interesting here is you can see there that patients, the needs, their wants, their preferences are known and taken into account, that the patient has access to safe, high-quality care, and that staff listen and provide emotional support to help and to treat patients. That's really clearly important to patients, because they're saying either in some cases we're doing it really well, which obviously represents some parts of the organisation, but in other areas we actually need to improve. Our quantitative data, we can actually break down by clinical program, we can break it down by site, and we can also break it down by time period. And actually having this data, very simple through our electronic surveys now done on Audit Angel, or the external data done through VHES, has really helped us improve and focus. And I'll be sharing that with you in terms of what have we focused on, what have we been able to improve on, and what are we really focusing on now. And that ties in beautifully to what Julie was actually talking about. So we have information going from the ward right through to the board. So in all of our clinical areas right across Eastern Health, we have about 64 clinical areas. All of those areas have to have their own local customised performance boards. There's some standard requirements with respect to what actually needs to be on there, but of course the detail needs to vary, because your risks in maternity are invariably not the same as what they are in mental health or in one of our general medicine wards. This data is showing you, based on the 10 questions, how well this particular area performed, and this again is just based on automated technology where patients are actually pressing their responses. We've had volunteers also engaged in helping patients actually understand and also respond to the questions as part of that process. And what that tells us is that overall our patients rank us at 87.3% in terms of meeting or exceeding those standards all of the time. Now, if we were a Hyatt or a Hilton, 87.3% would actually be good, because that's really 4.3 stars out of 5. But if you're a Langham, you might be a little bit concerned, because the Langham tends to be in the low 90s. You know, well, that was until the afternoon tea issues you may recall they had last year, when I'm sure they went below 90 there for at least a couple of weeks. But, you know, that's something that's really, really good. What Sir Robert Francis would say, though, who did the investigations into the NHS and into MidStaffs, he would say, you must celebrate the 87.3, but what about the 12.7? And that's a really important point, I think. The Victorian Health, and I should add, so that's, you can see there, 1,263 surveys in the last 3 months, and it's based on 10 questions. VHES, do you use VHES in the dental service? The Victorian Health Experience Survey? Not yet? Oh, you do? Yes, you do use it? Okay. Just in the day surgery. Thank you, Tracy. So 88% based on over 100 questions, but extremely close, isn't it, to what we're finding in our own internal data. So when people say to me, oh, you know, but patient experience data is subjective, I say, yeah, absolutely it is. It's all down to how the patient actually experienced their interaction with our health service. And now we're using patient opinion, and this is fantastic. So www.patientopinion.org.au. It's a free platform. Patients love it, and interestingly, I've noted a correlation. In terms of letters that come directly to me, I have actually seen a reduction in both compliments and also complaints coming directly to me. So in all seriousness, to get a letter to Alan Lilly or an email, you've really got to get a lot of L's all in the right place. And it's really interesting that patients will go to great lengths, but I think what's happening is in that search to provide feedback, they're finding the fact that we actually use, and of course you'll see in a moment, we promote it on our website, that you can actually share your story on patient opinion. They share their story, it goes to a moderator, then it gets sent to us, we do our response, it goes back to the moderator, and then it gets published back to the writer and also to us. It's a de-identified process from the patient perspective, and you can see here just an example of one of those stories. But if you want to see how we're answering stories, you can see that on www.patientopinion.org.au. Just type in Eastern Health and you will see all of our stories and all of our responses. I personally respond to all of those stories coming in on patient opinion within 24 hours, and that is my commitment, my own personal commitment to patient experience across Eastern Health. It gives me the best source of information in a very up-close, personal and sometimes confronting way. I have learnt so much about Eastern Health. We deliver a baby once every 2 hours in Eastern Health. What I didn't know, and seemingly not a lot of people did know, was that we don't have enough ultrasound scans, appointment spots for patients to actually have their scans at 20 weeks. We had started to normalise deviation within our own system. And so we've been able to make a lot of improvements, and we've currently got, as at today, we've actually got 214, but this is a few days ago, 210 stories. And I'm just going to ask you, how many times do you think those 210 stories have actually been read? We're happy to take bids. This is the audience participation. 20,000, thank you, Tracy. We'll take bids on 20,000. In an upwards direction, that is. 50,000. One more bid after 50. So just a little bit less. So in fact, as at 2 days ago, 81,361 times, people have read about the glorious things that we are doing in Eastern Health, but perhaps they've also read about the inglorious things. So it's a major platform for sharing information. And what I've been really interested in this process is I can identify with the author. So if the author, and they all have code names, so the most recent one a couple of days ago was Belvedere Ben, who'd had a fantastic experience Belvedere Ben had out at Yarra Ranges Health, so that was fantastic. He told us about his really, really good experience, and then I write my response back to Belvedere Ben. I can tell then, when Belvedere Ben, if he likes my response or not. And I can distinguish him from others who might actually like that response. So I might get Belvedere Ben likes this response, 2 out of 2 also like this response. What's interesting is I have answered some of the most curly patient stories coming in on patient opinion. People have liked my responses. In my response, I have invited them to write to me directly at my own email address, but they haven't written to me. And I think the reason that they haven't written to me is because they are satisfied that we have heard what they've actually got to say. And as a result, we've been able to turn around some of the most difficult situations, which potentially wouldn't be good for our reputation in the community and potentially may also provide us with some legal challenges as well. So people are fearful of the information, but what this slide clearly illustrates is that around 85% of the stories are just mildly, minimally, or not critical at all. This is rated by patient opinion, and I must admit, some of what they think is critical, I don't see why they think it's so critical, but they use a scale that they apply across all of these stories and all services using patient opinion right across Australia. But it's just been a great tool for us to actually use. We've also been fans of using the Net Promoter methodology, and I'm not sure if anyone here uses Net Promoter, but what we found was it was a little bit too ad hoc, and so one of the changes we are making is that next month we will for the first time be SMSing past patients, and we'll be asking them, based on your recent admission to the Angliss Hospital or Hillsville Hospital, how likely are you to recommend Eastern Health to your family and friends? So it's otherwise known as the Family and Friends Test. It's used extensively throughout the NHS. Apple is one of the leading Net Promoter Score companies across the world. Apple's scores invariably are around 70. So, you know, a Net Promoter Score there you can see hovering between 57 and 60 is actually quite good. It's very, very sensitive though, because if you understand net promoter methodology where you have to take the distractors away from the promoters and you have to exclude the passives altogether because they're not in the community doing you any harm, but they're not also doing you any good. The green people are actively promoting you in the community. The red people are actually damning your reputation. So it's really important to understand net promoter methodology is different, but very sensitive to changes and moving people up or down the rankings. But in this same data set, what it shows you is the average score is 8.4. So you could have said, oh, you know what, we scored 8.4 out of 10 and we could have just stopped at that point. But instead, we're using the Net Promoter Score because we truly want to move along. I'm pleased to say that we have our star rating on the website. So I must admit that 5th star never looks like it's 0.35 to me, but so I must get that corrected. But it's essentially, we're a 4.35 star out of 5-star organisation. I'm really proud of the fact that we have that on the front of our website. If you click on that when you go onto our website, it actually explains to you how we calculate that score. But right at the top of our website is our telephone number. And I've done a survey of health services in Victoria and New South Wales. I don't know where DHSV actually sits on this, but I can tell you that most health services don't actually have their telephone number on their front page. We also have our feedback button there right at the top. And it's really interesting because in terms of patients, and in particular older patients, you know, you have to go to the size 8, you know, sort of contact us, you know, to find those details. These are very, very easy things that we can do. But when you click on the feedback button in Eastern Health, you can provide feedback directly to us. You can provide your feedback directly to Patient Opinion. And then if you go on to Great Improvement, you can actually see a list of improvements which we have made. So we're genuinely using the patient feedback and then describing what improvements we've actually made. So I mentioned before our processes for overseeing the data and reporting the data, and what you can see there is how it ultimately also reports through to the board. Our board takes a huge interest in actually looking at patient experience of care data, and I'd have to say our Community Advisory Committee do a very good job keeping us all very, very honest in terms of our commitment to patient experience and consumer engagement. So I just want to share with you that we had, in 2012 to 2015, our focus was on these 4 challenges across the organisation. And reducing noise, for example, lots of people thought it was the overhead codes or they thought it was the pan rooms, but in reality, it was actually the staff talking at night. So you know when we used to work in the wards years ago, we'd often say, oh, it's good for the patients to hear us because they'll feel safe and they'll feel comfortable. I think we were just justifying very poor behaviour, really, weren't we, on night shift. But anyway, you can see there that those were the areas, and what you're able to see then is as a result of a series of interventions across each of those principles, we were then able to actually demonstrate improvements over the next 3 years. And here's some of the things already that we've been able to do from Patient Opinion. We had a terrible story about a lady who had come to our maternity service, to antenatal. Oh, it was just a terrible experience. It was characteristic of the phone conversation that Julie was referring to in her presentation. And then to just, you know, cap it all off, she went outside and she'd actually got a parking fine. So whilst I didn't want to, on the public record, set a precedent for agreeing to pay her parking fine, what I did do was guarantee to provide her with free car parking the next time that she came. And I tell you what, I had so many reminders popping up in my diary and my EAs because, of course, it was one of those examples to turn it around or to completely lose it. But anyway, fortunately, everyone was waiting for her. She got her free parking. Even better, though, she went back onto Patient Opinion and she posted her feedback. So that's a really good example of how we can actually be using feedback. And now the You Said We Did, it's really, really good for patients to see that we are doing things. But you know, it is surprising the obstacles. So the other week a lady wrote in, she'd waited a long time for an injection in antenatal. So she commented about that. She commented also that she was with a toddler and there were no toys to play with. So I wrote back, full of enthusiasm, you know, that we were going to follow this up, and thank you so much for sharing your story. I reckon the box of toys sounds like a great idea. Well, I tell you, it felt like a great idea till I told everyone else that I thought it was a great idea, and then, oh, Have you heard about all of the infection control regulations that will prevent you from having a box of toys? Anyway, I'm pleased to say we've now found a new panel that meets all of the infection control standards, and it is about to be implemented. And one of the great things then about patient opinion is we can take a picture, and some of our stories in terms of our responses, we can also upload our pictures as well. Our priorities, though, for this year are really, really simple. We only have one. I have said, I want to be a Langham Hotel, that is without those afternoon tea issues that they had last year. And what would it take for us to get consistently into the mid or the low 90s? So we looked at our data, and of course to improve, you've got to confront the brutal facts. And if you confront the brutal facts for us, what we identified was we weren't doing very well when we got into the bowels of communication. And when we got right into that, what we actually highlighted was sometimes our staff are considered to be rude and sometimes our staff are considered to be dismissive. So this year we have one mission, courtesy and kindness, every time, everywhere. And I keep asking people now the question, and I heard one of the ABC presenters the other week talk about a kindness quotient, and I just thought, that's it. I'm going to start asking people, what is your KQ? So that's what we're doing now across Eastern Health, very much focused on courtesy and kindness. It resonates with people. People actually get it. And someone the other day gave me a K tag, which is a, here you go, Alan, thank you. That was a random act of kindness because I was telling them a story about something and she happened to have one of these K tags. And we're looking at, and then what happened is someone then has done something really positive for me a couple of days ago because we've got an upcoming research dinner and some people are really, working very hard on it. And I said, I'd like to give you my K tag, and then they get the pleasure out of receiving the K tag and then they give the K tag to someone else. So we're looking at actually rolling out K tags, a K obviously for kindness across the organisation. Very simple, but very symbolic and very effective. Just a couple of reminders there, I think, about the importance of kindness. So we write a quarterly patient experience of care report. We have a huge focus on patient experience. As you can see across the top there, this is our organisation scorecard. We have 90 indicators every month. That's the top, that's the bottom. And you can see there right across the top, we score each of our performance across each of our 5 strategic directions. And then I could say at the end of February, we were 87% on track with all of our KPIs right across Eastern Health, across our 5 strategic directions, but 92% pleasingly on a great patient experience. Then we wrap that up at a higher level. Patient experience has the same standing in our organisation. I mean, some might argue it actually has a higher standing, and I think that might be a good thing than perhaps talking about finance and access all of the time. Jennifer Williams, very highly regarded woman, is currently the chair of Northern Health. I worked with her when she was the CEO of Alfred Health, and I still remember in her farewell speech, she said, when I came, it was all about access and finance, and now I'm leaving, it's still about access and finance. Some things really don't change, and I think she made a really, really good point. So sometimes you've really got to take get on a mission to get out of that, sort of access and finance quagmire. So there you go. And finally, just again, coming back to Julie's presentation, we asked ourselves the question, could MidStaffs happen at Eastern Health? And I said to our board, I want to turn hindsight into foresight as much as I possibly can. So what I did was I poured through the million pages in the MidStaffs reviews. And I also looked at a fantastic publication called The Well-Led Organisation. It's actually an accreditation requirement in the UK with the Care Quality Commission. There is a domain called The Well-Led Organisation. So I took a publication put out by King's Fund and I married indicators that are positively correlated with deteriorating performance with those that are positively correlated with high-performing organisations. And we have distilled that to 20 indicators. So this is another A3, top and bottom. It's very early, but we're really pleased with it's proving that a focus simultaneously on understanding the staff experience and staff satisfaction in the organisation has a positive correlation, as Julie eloquently pointed out in her presentation. So whilst it is indeed very, very early work and somewhat crude at the moment, it's certainly of great benefit to our board, and we provide that information every 6 months. We provide an annual report called In the Patient's Shoes, which is our quality of care report every year back to the community. And I really just wanted to conclude by acknowledging the fantastic people I work with, and in particular Gail Smith, who is our Executive Director of Quality Planning and Innovation. Joe Gatehouse, who is our Director of Quality and also our Chief, if you like, Experience Officer within the organisation, and Tanya Hendry, who is our Manager of Consumer Engagement. You know, I'm so lucky to actually work with so many fantastic people, and it's one thing to actually have aspirations, but to actually be able to achieve them, of course, as you would all understand, we need lots of other people. Those three people have got our program to be recognised nationally, and I'm really proud of the work that we have been doing, and in particular, the work that they have been leading. So thank you all once again for the opportunity to talk to you today about all things patient experience. You may or may not be aware, but last week was in fact the International Patient Experience Week, and so there has never been so much discussion and so much conversation, in particular on Twitter, with respect to all things patient experience right around the world, and it's fantastic to see so many people here interested today in experience matters. Thank you very much.